Thank you for allowing me to come and be part of this again. It's kind of nice to look out and see lots of old friends over the last decade or so. We've been working on these things. Um, so we just have a few minutes, of course, to go through this. So Health Canada, of course, is sort of an equivalent of different sections of the U.S. government down here. So we do actually have the what is in USDA in terms of the Centre for Nutrition Policy and Promotion is actually the Office of Nutrition Policy and Promotion in Health Canada. We also have um, the uh, the equivalent of parts of the FDA as well with respect to the regulations. We also have the body that regulates the supplements and stuff and sort of looks after that. So it's a different part of your government as well. So we are really use the DRIs in really across the board in terms of everything that we are doing there, whether it has to do with our policies and our strategies, or how we're assessing dietary intakes, the standards, dietary guidance, and any sort of translation products that we create as well for both health stakeholders and also for Canadians as well. One thing that David, you mentioned had to do, of course, with the NHANES. We do have our equivalent of an NHANES up in Canada, the Canadian Community Health Survey, where we, again, what we're looking at the basis of this is we're monitoring all of these nutrients of public health concern, of which sodium is one of those. So I thought rather than get into details as much, I just thought I'd make this sort of relevant with respect to what it is that we're up to right now as an example of how we sort of we take the results of all of these studies on the dietary reference intakes and build it into all of our initiatives. So a little bit of a run through of what we're doing. Now, what we have done up in Canada over the last few years is sort of to bring together all of our different healthy eating and nutrition initiatives under this sort of what we call our healthy eating strategy. And the idea here is that we're trying to be very coordinated with respect to how we deliver on nutrition and healthy eating across the different levers, whether they're regulatory levers, whether they're setting standards, whether they're getting into promotion, or whether you're doing assessment. So these are the ones that we've actually committed to. I mean, there's a little bit of a political side on this as well. Our Prime Minister asked the equivalent of the Secretary here, but our Minister, to deliver on these particular topics that are here in what we call the mandate, so in a 4-year time period. So these are things that we will be completing in about another year and a half before the next election. Actually, we have to complete on these. So these range from, there are a number of different topics here where you can see the relevance of sodium in particular. So we've got, when you're looking at better nutrition information, we've got revising the food guide, improving food labels, an initiative we have on front of package labeling, of course, the food quality, reducing sodium in food, restricting marketing of unhealthy food and beverages, and then when you get access, especially up into the north, what we have with our Nutrition North program as well. So the DRIs are really sort of across the board, sort of underpinning so many of these particular initiatives. So just very quickly with respect to some of these initiatives, we are in the midst of redoing our food guide, and of course the different elements, whether you're talking about the basic guiding principles and policies are affected by the DRIs. The modeling we do in terms of our health eating patterns, of course, we do that with the basis of that is making sure that you're getting enough of the nutrients that you need to have and not too many of the nutrients of public health concern. And then, of course, the things that we're putting together for the messages that go out for consumers and other types of stakeholders as well. We have finished this particular, the nutrition facts, what we call the nutrition facts table, NFT for us. And of course, we've updated with respect to the sodium, but this is something that we keep updating. Again, the daily values are all based on, for the most part, the DRIs that come in. The front of pack labeling, this is an initiative that we've committed to as well. We're in the midst of putting out, we're in consultation right now on our draft regulations with respect to front of pack. And we're really focusing on this particular one, on these, in terms of having labels on the front of packs, and this will be regulated for every packaged food product. Well, there will be some exceptions as well on this, but that we're really looking at these 3 nutrients of public health concern, of which sodium is one of the basis of this. Restricted marketing of unhealthy food and beverages to kids. This is, again, another commitment that we have made to deliver on here. And the nutrient profiling model that we have developed for that is really, once again, focused on these nutrients of public health concern. So, the sugars, the sodium, or the fats on that. So Yeah, so, and then the one last thing that we actually got direction from was to really move on doing something about sodium in our food supply and sodium with respect to consumption. So we have just assessed the consumption levels, not released yet. We just got used a new CCHS, so the equivalent of NHANES data to see where we are now. We had committed back in 2010 to have a reduction so going from 3,400 milligrams of sodium down to 2,300. And what we'll see when we do release it, there has been a reduction, but not where we wanted to get to. And so what we're doing now is to develop reduction targets for the restaurant and food service industry. And of course, the front of pack ones will have an impact, we hope, on the food supply as well. If you're having these labels on the front of pack, which clearly point out when you are high in sodium, we expect to see changes in the food supply due to that as well, and also changes with respect to what Canadians are actually choosing to consume. So I'll just leave it at that. I don't think I need to go into any more details. I know Linda's got a bit more information that she'll run through when she talks about what the Public Health Agency of Canada is doing in conjunction with, we work very closely together as well, of course.